get an MMR vaccine, and then soon after the vaccine, they did the usual, to warn them about soreness at the injection site and all that kind of thing. And sometimes they bounce back to the doc's office or the emergency room, and they got this rash. And the mom will say, "We just got the shot. We got the shot to prevent measles, and look, the baby's got measles." You know, you can't get measles that fast because remember that I think I told you that there's an incubation period and the prodrome period. We talked about that kind of thing. But it's not unusual for a baby, a child, to have a reaction to some component of the vaccine that causes them to have a rash. And usually the rash is pretty short-lived, a couple of days, and it goes away. And you might have the mom give the baby some Benadryl, because it's one of these kinds of immunopathologic reactions. It's not an infectious disease that springs up in 12 hours after the shot. That's just not possible. But parents don't know that, so you need to talk them through it to allay their fears that no, the baby doesn't have measles. And if anybody asks you in the future, past medical history, don't say your baby had measles, but do say that they had a reaction to the vaccine, which within 12 or 18 hours of giving the vaccine. So it may be that it was a component. It may be an egg thing. We don't know why the body does what it does sometimes. But there will be a point in time when the kid's going to need an MMR booster. They're going to be a big kid by then, junior high probably, and it's just something to write in their baby book, and not be surprised if they have some sort of a reaction again, and they may not. Okay, immunopathology. That means something's wrong. We learned all the right ways for the immune system to respond to an insult, an invasion. But sometimes they do things that are exaggerated or opposite what you want it to do. And that's this whole area of immunopathology. Hypersensitivity or allergy is one of these exaggerated kinds of responses. Autoimmunity, we've talked about that the immune system has an immunosurveillance feature so that it will destroy its own cells that are programmed to destroy self. But sometimes that process gets broken, and our own immune system starts to look for and destroy self-antigens. And those are the autoimmune diseases that people sometimes suffer with. For some reason, women are a lot more likely to suffer autoimmune diseases, and there's some theories about why that might be. Immunodeficiency is another kind of broken immune system. We talked about an overzealous immune system, and this one is underzealous. It's sleepy, it's weak, it's deficient, it's not doing all the normal things that we've learned about. Sometimes it's the T cell line that's weak and sleepy, and sometimes it's the B cell side, and sometimes you're really unlucky and both sides are deficient. Cancer results from a lack of surveillance. The immune system is not seeing those those tumor cells as foreign and allowing them to grow. And sometimes the cancer cells are a result of a viral invasion. And if the virus had been brought under control, the cancerous process never could have gotten a foothold. So many times we think some cancers at least are a result of a lack of surveillance. Something in the immune system is not working well and allows this to happen. We talked yesterday about how if you live long enough, you're going to come up with some of these things happening in the body, because the longer you live, the less capable your immune system is of surveilling the area. 4 categories of hypersensitivity. If you look, if you read, if you do all your Google searches, you'll find out that by now there are more than 4. There are at least 5, but these are the ones that we will concentrate on. Now this shows the underreacting, the lack of zeal side of the immune response that can cause the surveillance process to break down and make us more susceptible to cancers. And it looks like this is more a T cell side of the immune system, because our cytotoxic T cells that should be able to see these virus-infected host tissues and get rid of them aren't doing their job. Or these crazy cells start to grow, and the T cell side should pounce on them, pour out granzymes and all these things on them to destroy them, but that's not quite happening. And it can be, like we said, we have sometimes it's B cell side and sometimes both. Sometimes babies are born with SCIDS, S-C-I-D-S, severe combined immunodeficiency disorder syndrome. But some babies just have B cell problems, some babies just have T cell problems at birth, and it's a genetic issue. The overzealous side can be regular old ordinary hay fever, seasonal allergies as a type 1 hypersensitivity reaction. The full-blown, about to die, shock and death type 1 reaction is anaphylaxis. And that's a B cell type of overreactivity. We also talked about, which isn't on here, we talked about super antigens and toxic shock. That can be one of these overreactive B cell side reactions as well. Type 2 or antibody-mediated cytotoxicity, which is what type 2 is, and you'll learn all about that, causes destruction of cells, an antibody-mediated destruction of cells. And the most common example of type 2 is A, B, O, and RH incompatibility. So the blood group incompatibilities are the type 2. Type 3, rheumatoid arthritis. We know rheumatoid arthritis isn't merely the joints get old and things start to hurt. This is actually an immune complex, autoimmune type destruction that's going on in in the joints and other tissues of the body as well. We talked about serum sickness a little bit when we talked about passive immunity, and if you have to receive a preformed antibody to horse venom, tarantula venom, whatever, and this antibody has been made in a horse or something like that, yeah, you don't die from the venom, but you can still have a type 3 reaction because the serum that's now in your body put there to save your life, your immune system is not real happy that it's there, and it's going to mount a type 3 reaction against it. Type 4, cell-mediated cytotoxic T(c) reactions are what's involved in graft rejection. Now, actually, it's two arms of this overzealous immune system that's involved in tissue rejection or graft rejection. There's a type 2, which is a quick response to a graft, and type 4, which is a later or a delayed immune reaction to a graft, but they both have one thing in mind, and that's getting rid of this kidney that doesn't belong here, this liver, whatever, tissue that's been transplanted, it doesn't want it. Even our tuberculin skin test is a type 4 reaction, cell-mediated reaction, contact dermatitis, people who are allergic to latex, latex gloves, and those things have pretty much been, powder that's in them, pretty much taken off the market. It's hard to find those these days, but those are type 4 reactions. This slide shows us all in one place kind of what mechanisms are involved. We know type 1, the allergic thing, is IgE mediated. We know it involves IgE standing up on the surface of granulocytes, coming into contact with antigens, and then degranulating. All of those allergic mediators are then released. Huge amounts of them in anaphylaxis, and some of the things that they cause are, runny eyes, sneezing, coughing, asthma. Type 2, the antibody-mediated one. Again, we said the classic example of that is blood group incompatibility. That's IgG mediated, or IgM as well. And then once IgG or IgM is on the cells, and stands on the cells, a complement can then be activated. And it's actually not the antibody that causes destruction of the cells, but it's the complement that the cascade 5B, 6, 7, 8, 9 causes destruction, holes in the MAC complex and all those kinds of things that causes destruction of cells. And some of the examples of clinical manifestations of a type 2 are there. 3, again, serum sickness is in that group. Rheumatoid parents have allergic kids. There seems to be a cell delaying feedings to parents because they just have this innate excitement to do it. But lots of education, lots of talking it out, lots of giving them information to read will benefit them and babies, especially if they already suffer with allergies. They're more likely to listen. But if you find a baby who the does not come from a particularly allergic family, and they've got skin manifestation of atopy, time to start sitting down and talking. Anaphylaxis is systemic, not a local. Asthma is a local hypersensitivity. It's just the respiratory tree. Atopic dermatitis or eczema is local. It's just on the skin. Anaphylaxis, we got total body involvement in this. This is why it can kill you. If you have a particularly reactive airway, everything can start to constrict. You have trouble getting the air in, trouble getting the air out. Because it's a systemic, explosive degranulation and secretion of all of these cytokines and interleukins and everything that's inside the histamines and all those things that are inside the granulocyte, it can lead to circulatory collapse, hypotension, shock, and death. So that's why we have to, when we recognize that we have a patient who tends towards having to go to the emergency room when they are exposed to some antigen, we have to make sure that we prescribe for them EpiPen. It's epinephrine, which will go against the histamines and all those mast cell released compounds that lead to airway obstruction and circulatory collapse. It's in a little pen, looks like a pen, and all they have to do is stab it into their, usually their thigh. They get a big blast of epinephrine before they can, while you're calling, 911, getting yourself to the emergency room, and that can be life-saving. What are some of these things that can lead to type 1 reactions? Not so much as we think about foods as being problematic. They're not, most of the people who are allergic, they're allergic to other things, not so much things that they eat. Now, there are certain food allergens that are killers, and they tend to be shellfish and nuts, peanuts in particular. You can be allergic to all these other things as well, but the real troublemakers are the nuts and shellfish. I love shrimp. I just love shrimp, and I have loved it as a kid, but when I ate it, I would feel a little bit nauseous. Tummy just feels a little funny. And as I grew, teen years, when I would eat it, my palate would start to feel itchy. But I love shrimp. Or she's just gonna, want big butterfly prawns, So I knew I was having an issue, but it was never anaphylactic. And I never had any breathing issues. I just felt not good after eating wonderful ocean insects. And after a while, I said, you know what? You're in denial. You don't need to eat these things. Or what I started to do is I started to pre-treat myself. We're going out for seafood. I pop a couple of Benadryls and I'm all good. Still gonna get shrimp. Okay? And I was okay with that. Pregnant with my second kid, and I was in my kitchen cleaning, deveining shrimp. And my hands started to burn, and then I just started to get total body hives. Like, oh, this is probably not good. So, went to my OB, and did you eat? No, I didn't eat. I really wasn't even going to eat them. I was preparing them for my husband, and everybody likes shrimp. So he said, no more shrimp for you. And he says, because the next time could be, your body's telling you, this is just on your hands, that this could be dangerous for you. And he said, also, whenever you go for radiologic studies, tell them about your shrimp allergy, because some of the injectable dyes cross-react with shellfish, so blah, 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 blah. Okay. Can I take Benadryl? Take it only when you need it. You really need it. If you really think you need it, you can take this much Benadryl. For the next 5 days, I would have periods of being normal. And then I would be able to say, what does my day look like? And whoever was with me would say, it's turning red. I can watch it turn red right before my eyes. And I would get hives off and on. I guess the antigen would just make its way, through my body. And I would have this skin manifestation of this antigen in my system that got there just from me cleaning shrimp. So I learned, and I took the advice of my obstetrician that I should probably not consume shellfish with any regularity, even pre-treating myself with Benadryl. Well, I got a pretty hard head. Yes, I do have a pretty hard head. I still really love shrimp. So instead of ordering shrimp when I would go out, I'd say, just give me a little bite. Just let me have a little bite. And I never got that whole body thing again, but my tongue would itch and my throat would itch and I'd feel nauseous just from a bite. So I became convinced that shellfish was not for me. And so I know that shellfish can kill you. So I became a believer. So when you have patients who come in and they tell you about particularly shellfish and nut allergies, give them the talk that you don't know when it's going to be, but if you've had this many reactions, every time you have a reaction, your body is seeing more antigen and your body is making more IgE. So you have more IgE available for the next time, for the next degranulation of your mast cells, and it could be very dangerous. These are all the things that we can inhale. Many people are allergic to one or more of those things. We always ask, have you changed anything? Any laundry detergent, any creams, any lotions? Because we can get antigen inside of us by what we put on us, even if it's shrimp juice. So these are the kinds of things that we've said already. Type 1 results in increased IgE production. Those IgE cells stand up by the Fc portion on mast cells and other target tissues and release allergic mediators, and the whole cascade that we've learned about can occur. The sensitizing dose, these are vocabulary words that go along with hypersensitivity, is the first time you come into contact with an allergen. And specific B cells born to respond to that particular antigen make IgE, and the IgE finds its way to those cells at the Fc portion. The provocative dose, it's a pretty cool sounding vocabulary word. You want to have your EpiPen. And we'll talk next time, we'll start next time about allergy testing. Okay, so, exam. I'll save all of the chapter 16 stuff for 3. So, the stuff that we've covered today is testable, but I'm going to save it for the next test, okay? You got enough fish to fry, right? Without this. All right.
So the exam will be on 14, 15, and 12?
12, yes.
14, 15. 12.